This is a very personal issue for our family. Several years ago, my grandfather experienced a major stroke, and while he survived for several more years, the quality of his life was dramatically altered. Had the promptness of his diagnosis and the comprehensiveness of his care been more timely and robust, we think that his outcome could have been much better. That's why ever since, our family has been very interested in areas of research around stroke and how to better care for stroke victims.
Stroke is a very serious medical condition in our community and nationally. It is the 5th leading cause of death amongst adults in our country. It is the #1 cause of disability amongst adults. Every 40 seconds, someone in this country has a stroke. And every 4 minutes, someone dies secondary to the disability caused by stroke. There are over 800,000 cases of stroke in this country each year, and this number is on the rise.
Our South Jersey communities are especially at high risk for stroke due to a variety of risk factors, including high blood pressure, heart disease, diabetes, and obesity. In addition, aging of the population and poverty contributes to these risk factors as well.
This year, the Kennedy Healthcare Foundation has chosen Kennedy's Stroke and Neuroscience program to be the beneficiary of the Kennedy Gala. We believe that even small investments in these programs could make a big impact with regards to stroke awareness, care, and prevention.
The neuroscience program at Kennedy has been a huge asset to our community, providing improved outcomes for patients with stroke. Our Washington Township Hospital has been designated as a comprehensive stroke center by the New Jersey Department of Health and Senior Services. And system-wide, our neurology and emergency department personnel are trained in the diagnosis and treatment of acute stroke.
We are educating many people. We are reaching to community, to schools, teaching how to determine early signs of stroke and risk reduction, but we can do better.
Funding from this year's Gala will initially impact 2 areas of our Neurosciences of Stroke program. First, we will be enhancing critical care monitoring systems for stroke patients with the acquisition of new equipment.
The ability to monitor these patients will allow them to stay in our community following a stroke or seizure, rather than transferring them to a specialty center. This keeps them close to their families, while ensuring that any changes in their condition will be observed by skilled neuroscience physicians.
With the additional funding, we are also planning to enhance our community education and outreach programs. We are going to begin a grassroots campaign creating a new website with the new education materials and multiple languages for non-English speaking residents.
Kennedy has a long history of service to our communities. When we see a need, we address it. Stroke awareness and treatment is an obvious enhancement for the people we serve.
That's why MedMetrics is excited to be the presenting sponsor for this year's Kennedy Healthcare Foundation Gala. Stroke is very personal, and we are very excited to support Kennedy in their mission to develop high-quality stroke care programs.